Hi aspirants, welcome to my lecture. I will discuss an important topic, black fungus in science and technology, GS paper 3. This lecture will cover what is mucormycosis disease, symptoms, diagnosis, impact of black fungus, treatment and preventive measures. This is an important topic for civil services prelims and mains examination 2021. Now let us discuss what is mucormycosis disease. Mucormycosis is a serious fungal infection, but otherwise rare, has been observed in a number of COVID-19 patients recently. It is a rare but serious infection caused by a group of molds known as mucormycetes present naturally in the environment, which mainly affects people who are on medication for health problems that reduces their ability to fight environmental pathogens. Second, sinuses or lungs of individuals get affected after they inhale fungal spores from the air. Third, the rise in cases of mucormycosis seen among people hospitalized or recovering from COVID-19. Usually, mucormycetes does not pose a major threat to those with a healthy immune system. What are the symptoms? This include pain and redness around eyes or nose, fever, headache, coughing, shortness of breath, bloody vomits, and altered mental status. Warning signs can include toothache, loosening of teeth, blurred or double vision with pain. Diagnosis. It depends on the location of the suspected infection. A sample of fluid from your respiratory system may be for testing in the lab. Otherwise, a tissue biopsy or a CT scan of your lungs, sinuses, etc. may be conducted. Now, what are the impact or consequences of black fungus? After contracting the disease, following would occur or result. First is nasal blockage or congestion, nasal blackish or bloody discharge. Second, cheekbone and one-sided facial pain, numbness or swelling. Third, blackish discoloration over nose, palate. Fourth, loosening of teeth, jaw involvement. Fifth, blood or double vision with pain. Sixth is thrombosis and skin lesion. Seventh is chest pain, worsening of respiratory symptoms. What is the treatment then? First, it is treated with antifungals. Mucormycosis eventually needs surgery. Second, doctors have recommended that it is of utmost importance to control diabetes, reduce steroid use, and discontinue immunomodulating drugs. Third, need to maintain adequate systemic hydration. The treatment includes infusion of normal saline before infusion of amphotericin B and antifungal therapy for at least 4 to 6 weeks. Fourth, it can lead to loss of the upper jaw and sometimes even the eye. Fifth, with appropriate artificial substitutes or prosthesis, the eye or upper jaw can be effectively replaced. Frequency of cases detected. There has been no major outbreak in the country. Traditionally, we see a case every few months, usually in poorly controlled diabetic and immunocompromised patients. But in the past few months, almost 25 to 30 cases have been registered. Patients most vulnerable to mucormycosis are those who have been treated with steroids and other drugs for COVID-19 to reduce inflammation. What are the preventive measures? First, it is a rare disease. However, some groups of people are more vulnerable, like patients with uncontrolled diabetes mellitus, immunosuppression by steroids, prolonged ICU stay, and comorbidities, post-transplant malignancy, voriconazole therapy. Other preventive measures recommended by experts are using masks at construction sites. Second, while handling soil, moss or manure. People needs to wear shoe, long trousers, long sleeve shirts and gloves. Third, it is highly important to maintain personal hygiene including a thorough scrub bath. Now we come to the conclusion. Although cases of mucormycosis are being seen across the country, city-based doctors have stepped up awareness about mucormycosis and collecting data for large studies, which is emerging as a significant challenge, and its symptoms should not be ignored in the second wave of COVID-19 infections. That is all for now. Before I sign off, do tune in for my next videos on new topics. Please share the video with your friends and subscribe in large numbers. We really appreciate your encouragement and constructive suggestions. Stay awesome until then. Thanks.